Hello, I'm Dr. Eve. Welcome to the Sexual Health Center. Managing menopause is a challenge for many women as well as their partners and maybe even their children and families at times. I'm always struck by how healthcare providers, especially the young medical students, think that the moment that a woman hits menopause, that's the end of her sexuality. And maybe that's what you think as well. Menopause begins from the time that you have the cessation of your period. It means last time you bleed, that's when you really go into menopause. But before that, a few years before that, you go into perimenopause, where you have irregular bleeding and you begin to get some of the symptoms of menopause, such as hot flashing, some memory loss, some achy joints, some depression, and really feeling restless and agitated, slightly tetchy. Please do not go onto an antidepressant before you have your blood levels checked. Get all of your sexual hormones tested before to see if you are in perimenopause or not. For the women who've had any kind of hysterectomy or their ovaries removed or have had cancer treatments, you will go into surgical menopause no matter what the age you are, and that will mean that you will feel all those symptoms as well. It's so vital to have a healthy lifestyle before you go into menopause. So by the time that you are menopausal, you're not sitting with extra weight and extra lifestyle diseases that you don't have to have if you look after yourself from early on in your life. However, if you've arrived at menopause and you find that things are changing in your body, please start practicing a healthy lifestyle. Lose the weight, drop the alcohol, stop the smoking, do the exercise, get yourself as healthy as you possibly be to make sure that you feel well. Important to consult with a gynecologist, with a specialist who can give you information and educate you about the options that are available to you in terms of hormone therapy. Not every woman chooses to do that. There may be familial history reasons why you can't do that, but I urge you to find out the benefits versus the risks before you make the decisions that hormones are going to give you cancer and that they are unhealthy for you. It's not true. Find out the facts first. Hormone therapy is very cardioprotective. There's a slight increase of breast cancer, which may in fact not be such a high risk for you. Get the information, find the facts before you suffer. And you really can suffer if you do not manage your menopause. I have a range of vaginal renewal programs for women to take care of the vaginal dryness that's going to follow automatically as you go into menopause and lose your estrogen. Please come into the store at the Sexual Health Center. Go online, dreveshop.co.za, and look for the vaginal renewal range to be able to replenish your vagina so that at least you feel you can be sexual again. Manage your menopause wisely and healthily. Find me on dreve.co.za, follow me on Facebook, go to the Hot Flash Havoc Facebook page, which is there just for you as a menopausal woman, and follow me on Twitter.